So I'm going to be telling you about the stool test that you can do that can detect bowel cancer early without you having any symptoms. These are the symptoms that would warrant further investigation for suspected bowel cancer. If you have an abdominal mass or a change in bowel habit or iron deficiency anemia, or if you're aged 40 and over with unexplained weight loss and abdominal pain, or aged under 50 with rectal bleeding and any of the following unexplained symptoms such as abdominal pain, weight loss, or if you're aged 50 and over with any of the following unexplained symptoms such as rectal bleeding, abdominal pain, weight loss, or if you're aged 60 and over with anemia even in the absence of iron deficiency. Now in the UK we have the NHS system, which is free unlike most other countries. However, the NHS is reaching its breaking point. So there are certain parameters in place that the system has put in to avoid everyone rushing in at the same time with the symptoms, especially if you suspect that something's wrong and you need a referral or investigation to find out what's going on. In regards to bowel cancer, you have to be experiencing some of these symptoms for a relative period of time, such as longer than 6 weeks. For instance, with changing bowel habits, whether you're experiencing loose stools, diarrhea, hard stools, or constipation, if you're having loose stools for just a day or just a few days, then your doctor might say come back in 6 weeks. But you might be panicking because you're thinking, could this be cancer? Especially if you've had a friend or relative who had recently been diagnosed with bowel cancer and at a young age. So without waiting 6 weeks to see your doctor or to do a test, you can now decide to go privately and do the stool test, and it's called a FIT test, otherwise known as the faecal immunochemical test, FIT. I'm not going to bore you with the scientific background as you can Google it, but the FIT test detects the presence of the breakdown products of human hemoglobin in the stool, which is not visible to the naked eye, and it is very sensitive and specific to conditions like bowel cancer. In the UK, the cutoff mark for a positive FIT test is 10 micrograms of hemoglobin per gram. So if you're positive and you have a value greater than 10, then this means that your test is abnormal and you need further investigation. But if your FIT test is negative, then it is very unlikely that you have bowel cancer. However, a positive FIT test is not specific to just bowel cancer, and you should think of other causes like hemorrhoids, fissures, inflammatory bowel disease, benign polyps, infectious diarrhea like Shigella, Salmonellas, diverticulitis. So again, do not panic if you have a positive FIT test, as this does not mean you definitely have bowel cancer. And there are other stool tests such as fecal calprotectin for inflammatory bowel disease, Helicobacter pylori stool test for Helicobacter pylori infection, and stool culture for infectious diarrhea. So a positive FIT test means you then go on to have a colonoscopy to look for cancer or any other causes such as polyps or inflammatory bowel disease. So if my FIT test is negative, do I still need a colonoscopy? If the symptoms are still there, then most likely your doctor will be recommending you to have a colonoscopy. Now in terms of bowel cancer screening in the UK, if you're aged between 50 to 74, you should have an invite for bowel cancer screening. You then get a kit sent through your post where you have to provide a small stool sample and you send it back. And this is to detect any cancer early before you have any symptoms. And if positive, you then get sent for a colonoscopy. I hope you enjoyed this video. Please feel free to share, like and subscribe.